Did you know that every year, countless people around the world miss the early signs of cancer because these warning signals can be so subtle that they're easy to dismiss? In fact, research from the World Health Organization suggests that early detection can improve survival rates significantly. Yet many individuals remain unaware of what to watch for. By the time they realize something is wrong, the disease may have advanced to a much more dangerous stage. That's why today, we're going to explore 8 crucial signs that could point to different types of cancer. Recognizing them early could be the life-saving difference between catching a malignant growth in its infancy and facing a more challenging battle later on. Before we dive deeper, please take a moment to like this video, subscribe to our channel for more life-saving health information, and share it with someone who might benefit from this knowledge. Sharing awareness is a powerful tool. It might save someone's life. Now that we've set the stage for why this topic matters so deeply, let's transition to the first set of 4 early warning signs that you absolutely should not ignore, no matter how minor they may initially seem. The first 4 warning signs. One of the most overlooked signals that could indicate an underlying malignancy is unexplained weight loss. This isn't just a few pounds dropping off over several months due to changes in diet or exercise. Rather, it's a significant drop in weight, often 10 pounds or more, that happens without any clear reason. According to the American Cancer Society, about 40% of patients report this symptom at the time of diagnosis, especially in cases of pancreatic, lung, or stomach cancer. If the pounds seem to be melting away and you can't pinpoint why, it's important to consult a healthcare provider for a thorough checkup. Next, be alert to persistent fatigue that goes beyond normal tiredness. We all feel tired at times, but when exhaustion persists despite adequate rest or disrupts your daily routine, it could be a sign of serious health issues, including leukemia or colon cancer. Medical experts emphasize that this type of fatigue might feel more like a constant lack of energy rather than the usual tiredness from a busy day. Another key indicator is changes in skin appearance, which can include any unusual moles, spots that don't heal, or variations in color and texture. Skin cancer, particularly melanoma, can go unnoticed until it's at a risky stage, so keep an eye out for sores that stay open or blemishes that evolve over time. The Skin Cancer Foundation reports that early-stage melanoma has a 99% 5-year survival rate, underscoring the value of early detection. The 4th sign in this initial batch is chronic pain, which could manifest as persistent back pain, headaches, or aches in the bones and joints that linger longer than expected. Though pain can arise from many conditions, persistent discomfort that doesn't respond to usual treatments may be connected to bone or ovarian cancer, among others. Pain is a signal from your body that something's off, and if it refuses to subside with typical remedies, it might be time for screening. Now that we've covered these first 4 alarm bells, unexplained weight loss, persistent fatigue, skin changes, and chronic pain, let's move to the next 4 additional signs that might be less obvious but are equally critical. The remaining 4 warning signs. Moving on, let's talk about persistent cough or hoarseness, which many people associate simply with seasonal allergies or a lingering cold. However, if you notice that this cough lasts for more than a few weeks, or your voice remains hoarse, even after addressing common causes like infections, you should consider getting checked. Research points out that persistent coughing can be a red flag for lung or throat cancer. If you're regularly coughing up blood, it's especially urgent to see a medical professional. Another sign that deserves immediate attention is unusual bleeding. This includes finding blood in your stool, urine, or even coughing it up. While blood in stool could be due to hemorrhoids or minor tears, it also accounts for about 20% of initial indicators in colorectal cancer diagnoses. Similarly, blood in urine can point to bladder or kidney cancer. Don't dismiss these occurrences as freak incidents. They serve as your body's distress signals. Equally important are changes in bowel or bladder habits, which might seem like small inconveniences, but can be symptomatic of prostate, bladder, or colorectal cancers. Sudden constipation, diarrhea that lasts longer than normal, or unexplained shifts in urination frequency and color can be signs that a serious issue is developing. If you notice that these patterns persist or become more severe, consider booking an appointment with a healthcare provider for an evaluation. Lastly, pay close attention to lumps or swellings anywhere on your body, commonly found in the breast, neck, or even the armpits. While not every lump is cancerous, a hard and painless lump in these areas could indicate breast cancer, lymphoma, or other malignancies. Performing routine self-checks is vital. For example, regular breast self-exams can catch changes that you might not otherwise notice until they become more serious. Remember, finding a suspicious lump isn't a reason to panic, but it is a reason to seek a professional opinion as soon as possible. Having now outlined these 8 critical signs: unexplained weight loss, persistent fatigue, changes in skin appearance, chronic pain, persistent cough or hoarseness, unusual bleeding, changes in bowel or bladder habits, and lumps or swellings, let's move to the next part of our discussion: what steps to take if you notice any of these indicators. What to do if you notice these signs. If any of these 8 early warning signs ring a bell, the most important advice is don't panic. It's natural to feel a surge of anxiety, but the next best step is to consult with a medical professional who can guide you through the correct tests or screenings. According to authoritative health guidelines, screenings such as mammograms, colonoscopies, pap smears, and specific blood tests can detect early cancerous or precancerous changes, often before any symptoms arise. Consult your doctor about which tests might be right for you, especially if you have risk factors such as a family history of cancer or lifestyle habits like smoking. Besides clinical checkups, consider adopting preventive measures that lower your overall cancer risk. A nutrient-rich diet full of fruits, vegetables, and whole grains combined with regular exercise can significantly reduce the likelihood of developing various cancers. The World Health Organization estimates that up to 30% of cancer cases can be attributed to lifestyle choices like poor diet, physical inactivity, and tobacco use. Quitting smoking, minimizing alcohol consumption, and maintaining a healthy body weight are all ways to mitigate your risk. Even managing stress through mindfulness, meditation, or counseling can have a positive impact on your immune system. By being proactive about your health, you stand a much better chance of detecting any problems early. Now that we've discussed the practical steps you can take once you recognize these signs, let's move to the conclusion, where we'll emphasize the power of awareness and how you can help spread this crucial information. In conclusion, of these 8 early cancer signs: unexplained weight loss, persistent fatigue, changes in skin appearance, chronic pain, persistent cough or hoarseness, unusual bleeding, changes in bowel or bladder habits, and lumps or swellings. Each one of these indicators can be subtle, but staying vigilant is key to catching potential issues before they escalate. Early detection isn't just a phrase, it's a lifesaver. Medical statistics consistently show that cancers caught in the initial stages have far more effective treatment options and significantly higher survival rates. It's our hope that by highlighting these early signs, you'll feel empowered to listen to your body and seek professional help when something doesn't feel right. Remember, you have the power to protect your health by staying informed, taking preventive measures, and sharing this knowledge with others. If you found this video helpful, please like, share, and subscribe to our channel for more life-changing health insights. Turn on notifications so you'll never miss an update. And most importantly, spread the word. This video could be the wake-up call that someone desperately needs. Stay informed, stay vigilant, and always prioritize your well-being, because your health is truly your greatest wealth.